Brushing for the spinal gallant. In this movement, we position the child on their tummies comfortably with their lower back exposed. We're going to be applying different sensations using different brushes to the lower back, not on the spine itself, but to either side of the spine in the muscles. When we're providing this stimulation, what we're not looking for is too much flinching or discomfort for the child during the process. So we need to be quite careful about the different types of brushes that we may be using. So the choices would be around a silicone brush, such as this, that's quite soft, or an exfoliating body brush with bristles, also fairly soft, up to slightly harder ones such as a nail brush or a tangle teaser, so the harder plastics of the tangle teaser. So rule of thumb would really be starting with something a little softer and seeing the reaction, and generally just moving through the brushes till you find the right level for the child that the child can tolerate. So starting with this brush, what we're going to do is we'll place it here at the lower back, and we're just going to go up the back in sweeping motions. About 5 to 6 times on one side, and then 5 to 6 times on the other side. When we do this sort of stimulation, you will start to see some children's backs will begin to redden. And as you see the redness or the blush emerging, just be aware of it, because if you keep going over it too much, it could get quite sore and on occasions bruise. So try to stay away from that. Just see that as an indication that the child's probably had too much. If you're not seeing any blush, you can keep this going for about 30 seconds to a minute.